Chances are by now you're painfully familiar with the results of Muslim terrorism. Those of us old enough to remember the images from 9/11 will have them forever emblazoned in our memory of what it looks like when radical terrorism is left to enact their violence. What you're probably less familiar with is the creeping deadliness of the Middle Eastern culture taking over our nation. Most of the Western world has done a great job of fighting back common illness that killed millions during less enlightened times in history. Scientific advancements have taught us things like the importance of hand washing, and how to commonly prevent the spread of disease. However, those who ascribe to Islam don't always follow those basic rules, and it can be deadly for people around them. Because of the astronomical influx of immigration into Michigan, especially the Dearborn area, which is becoming pervasively more Muslim at a disturbing rate, some of those diseases are beginning to travel again, and it's affecting everyone. According to Food Safety News, one area close to Dearborn is suffering an outbreak of hepatitis A, which is extremely communicable, especially through fecal matter. Monroe County Health Department, MCHD, has confirmed a second case of hepatitis A in an individual who works at a local restaurant. MCHD is providing information to alert residents and guests to the possible exposure and to recommend prompt hepatitis A vaccination or immune globulin (IgG) treatment to potentially exposed individuals. The diagnosed individual works at Tim Hortons restaurant located at 404 South Monroe Street in Monroe. Anyone who consumed food and/or drink from the restaurant between December 10, 2017, and December 28, 2017, may have been exposed. While the mainstream media is far too politically correct to attribute a race to patient zero, the coincidence is far too blatant to be ignored. The stigma of hepatitis going hand in hand with Islam is so strong, that one Muslim doctor even tried to convince people that talking about hepatitis was Islamophobic. Jihad Watch, Islam expert Robert Spencer noted, unsanitary practices in the Fremont clinic led to hepatitis C infections in at least 99 patients, several of whom died. But it was all Islamophobia, don't you see? After fleeing the country to avoid prosecution, in Pakistan, Javed became a public health official and reportedly blamed the situation in Nebraska on anti-Muslim sentiment. On Spencer's site, one commenter was loaded up with sarcasm. So hepatitis germs are Islamophobic now? Does the American Medical Association know about this phenomenon? Any illness that's synonymous with a religion should concern those who live near large groups of people who practice that illness. In the cases that the doctor was talking about above, they were referring to Hep B and C, which are far less communicable than Hep A, the outbreak that Michigan is dealing with right now. MCHD is working with the restaurant to vaccinate all employees, determine if there are any additional cases and to eliminate any additional risk of exposure. Concerned individuals are urged to contact MCHD or their healthcare provider with questions. The hepatitis A virus is most commonly spread from person to person by the fecal-oral route. Most infections result from contact with an infected household member or sex partners. Sometimes, infection results from food or drink that is contaminated with the virus. It is not spread through coughing or sneezing. Anyone who has hepatitis A can spread the virus to others for 1-2 weeks prior to symptoms appearing. Frequent hand washing with soap and warm water after using the restroom and before handling food can help prevent the spread of hepatitis A. Thoroughly preparing foods can also help prevent infection. Freezing food does not kill the virus. Anyone who has consumed food and/or drink at Tim Hortons from December 10 to December 28 should monitor for symptoms of hepatitis A, which include fatigue, poor appetite, stomach pain or tenderness, nausea or vomiting, dark urine, and yellowing of the skin, jaundice. Most children less than 6 years of age do not experience symptoms. Symptoms typically appear 2 to 6 weeks after exposure. Individuals with symptoms should call their healthcare provider and seek medical care. Earlier, the department is extended their free hepatitis A walk-in clinic, through the week of December 18 through the 22, where at least 1,800 people were vaccinated after the first employee with hepatitis A was announced. The clinic was for anyone who consumed food and or drink between November 21 and December 8 from the same Tim Hortons location. Outbreak in Southeast Michigan from August 2016 to December 20, 2017. There have been 630 cases of hepatitis A diagnosed in Southeast Michigan. Monroe County has 14 confirmed cases of hepatitis A. Terrorism alone should be enough to make America want to keep Islam away from the civilized world, but knowing that their religion details the everyday lives of their followers in such a way that they breed diseases is just another way that Islam is breaking down America.